in healthcare, in long-term care, I actually started out as a CNA. And what that did was allow me the experience to really grow, not only personally, but with the profession. So from that CNA into a med tech and then into a wonderful nurse. And it's given me such joy to see the growth, but build those relationships. So the responsibility of infection prevention and control, it is the responsibility of all. If it's residents, family, staff, visitors, anyone who comes in and interacts with our community, it is the responsibility of all. However, with that said, for example, in the skilled building that I'm in, or I should say the skilled cottage that I'm in, there's designated infection preventionists. And that's not only to meet the regulation, but best practice that infection preventionist is there on site. But to the question, who is responsibility? It is all of our responsibility, everyone. I'll tell you why I think infection preventionists are so important. They save lives. And as we continue to age, and what a privilege that is, that we would want to make sure that these infection preventionists are doing everything they possibly can to have a quality of life and one that's free from all of these illnesses and why we can't be totally free from that. They can sure help us better protect us so we can live a higher quality of life. There's so much research and evidence that's out there that, the better we can take care of ourselves, our overall well-being, it impacts every single thing that we do. So our infection preventionists have a great part in our everyday lives, and we thank them for that. We share measurements with our staff with regard to infection control practices. So to give you an example, if we are doing hand hygiene audits or observations, if we're looking at gloving or degloving, we may do audits monthly. It's not may, we do monthly to ensure best practice. We will share those findings. Quite often, what I see is we are so good at collecting data. We really are. But are we doing a really good job of sharing that with the teams who are giving us that data, not only from a quantitative, but a qualitative? And so when we're in these all team meetings, for example, or how about a daily huddle where we're actually including floor staff, you have your leadership teams there. It's your opportune time to share, hey, team, look, we did an audit yesterday and 10%, wow, 10% we did observations and 99% were at protocol for hand hygiene. And then you get that woohoo, everybody starts clapping and they can actually see. And that's what's important. Staff need to actually see that their efforts are making a difference. So, how we engage with residents and families with regard to infection prevention and control, because we're engaging with them daily. We will have signage, we'll send an email, we will do phone calls as needed, but it's the constant communication. And let me interject, transparent. We need to let the families know why we're doing what we're doing so it eliminates any curiosity or any inadvertent fright. In other words, they may come in, and if we didn't communicate properly, they're going to see us in N95s and they're going to say, uh-oh, what's happened? What's going on? Well, we want to eliminate that. So we're engaging them right from the get. We're sharing informational resources from organizations, from agencies. We're letting them know again the why of what we're doing. And once we do that, I will say that's a great trust builder as well. So when they do come into our communities and they see the signage that says, we have an outbreak, you must don PPE, they don't come in and say, oh my goodness, again? They don't do that. They just go through the protocol knowing that, you know what? I'm going to have to wear my mask because I know this is going to help protect all those that I interact with so we can avoid having a future outbreak. We are so privileged to enter those buildings. They're their homes. And we need to make sure that we're following protocol in their home. And residents are the first to tell us if they see someone that maybe doesn't have their mask pulled up all the way, they'll call them right out on it. And that's what you want. You want a culture or a home where we're all transparent with each other. So residents, I will tell you, have been our biggest advocate. And why is that? Because we're open with them. We're informing them with educational materials, best practices. It's the constant communication, I think, is key to all of this. I have a story that I would like to share that, especially at the peak of the pandemic, and I'll do this without shedding a tear. I will try. I'm a nurse and proud to be a nurse. I'm here to provide that quality of care, and how privileged, I mean that, am I to do that. And so on this particular day, I'm in our memory care area, and I'm in full PPE, as well as a gown, and I'm wearing my goggles, and I'm wearing an N95. And here I sit with my most precious resident who is on hospice. So I'm painting this picture because I want you to feel this, feel it. And as I'm sitting there helping her feed or helping her with her nutrition intake, the most precious thing, as she sits up, let me have a moment. And she looks at me with those beautiful eyes and says, "Oh, honey, can't you take off your mask? You're scaring me." And for that moment, I looked at her and I was this close of removing my mask because I felt what she was trying to say to me as she nears the end of life. And I looked at her, and you're going to smile when I say this because you have to be quick-witted and thinking. And I said, "Oh, I wish I could, but you know what? My doctor told me I have to keep this on my face." I said, "I'm going through that phase of life where I have blemishes." And I said, "I have to keep this on to preserve the integrity of my skin." And she looked at me and smiled with a smile I will never forget as long as I live. And she says, "Oh, honey, I remember those days. I went through it as well when I was your age." And I will tell you, that story resonated with me, but it talks about resilience. And I say that because we're human as nurses. We are faced with situations that our gut tells us, "I just want to take this off and I want to kiss her and love her and hug her." But you have to have that inner strength that says, take a step back, process, because what's the outcome if you do that? What is that ill consequence? It might make her sicker, but you have to do that like that, the flip of a switch, the snap of a finger. And I share that with you that in healthcare, regardless of the role, we are faced with decisions that plays on our emotions. And you have to have that inner strength to do that. And this is why education and that interpersonal communication and positive reinforcement is what we do. We are champions, and we have to be that with each other, because if we fail to do so, it could make the difference between life and death with those precious people that we serve. It's important that we all work together in this journey, in life's journey. We draw upon each other's strengths, each other's knowledge, each other's insights. And the more we can create an open culture, one that is transparent, one that is honest, You have greater collaboration where we're all working together towards that same goal. And along that, then is that cooperation. It takes a village, a team, as we know. This doesn't happen with just one person. And I think it's reflective of our everyday practice of the importance of culture, the importance to collaborate, and the need to cooperate with one another.